All right, good morning. In an effort to start on time, we should have Ian Martin giving our good morning welcome, but he might be tied up. And this is a busy day with a lot on our agenda, so let's just start. I'll start with my introduction. So I'm Jennifer White. I'm the chair of the Junior Faculty Development Forum, which hopefully everyone's in the right place. Yes? Good. And the purpose of this forum is it's for you, 100% for you, all of you, trying to figure out how to get here. So I don't know if you looked at the agenda and if all of these names sound familiar to you. If they don't, then you are in the right place. If they do, then you know what a fantastic place this is to be today. So we have some of the greats in emergency medicine here with us all day to answer your questions. This will be mostly panel, breakout groups, a networking luncheon, anything and everything you ever wanted to know about getting from where you are to where they are. Essentially, I think, what would you tell yourself, right? What advice would you give yourself sitting in these chairs now to get here? Maybe missteps, maybe things to say yes to, things to say no to. So we have a robust agenda. If there's anything that isn't covered, and I think there's a lot of overlap, I think you will be covering things maybe 2-3 different times from different perspectives. Just bring them up. This session is for you. So just a brief, my story. I did a very meandering path. I went to medical school, SUNY downstate, so Kings County Hospital, inner city. Then residency at St. Luke's, and then I did private group, Democratic group in Doylestown, Pennsylvania, which is an affluent little suburb, for 8 years, where I didn't have an academic title. I didn't do anything academic. I worked. I figured out how to be a doctor. I worked 1.0 clinical FTE, and in my mind grew up as a doctor because there was, in a community place, so I had to ship everything out. Very hard place to work right out of residency. Then I decided it was lonely and that I wanted to share good cases with people, and I wanted to do a little research, so I went to Mayo Clinic in Rochester, Minnesota, and I stayed there for 3 years. It turns out that it's very difficult to live in Minnesota if you're from New York. Yes, for multiple reasons. It's a great place, but then culturally came back to the East Coast, so now I'm at Thomas Jefferson. I have a couple of different hats. One is assistant program director. I've been doing that role for about a year because I love the residents, I love teaching. And then the other thing is associate medical director because I feel like it's important to have a seat at both tables to represent both things. I also have some academic interest in sudden cardiac death in the young and channelopathies and do some research. But as you'll hear today, the NIH-funded academic career path is difficult to embark on 10 years out of residency. So that is not the path that I went down. That's my story. So since Dr. Martin is not with us, we are going to start with Dr. Brown, Dr. David Brown, and I will let him do his intro because this is essentially his story.